Earlier, Governor Rick Scott poised to make a statement about Medicaid. Let's listen in. He's taking the podium now.
To buy insurance. And the second is whether or not we expand those eligible for health care through Medicaid. Because of the many unknowns that still surround the operation of an exchange, we will not commit Florida to running an insurance exchange. On the question of Medicaid expansion, there are no perfect options. To be clear, our options are either having Floridians pay to fund this program in other states while denying health care to our citizens, or using federal funding to help some of the poorest in our state with the Medicaid program as we explore other health care reforms. As I wrestled with decisions, I thought about my mom's struggles raising 5 children with very little money. I remember my mom's heartbreak when she struggled to find health care for my brother when he had a significant hip disease. She eventually found him at Shriners Hospital, hundreds of miles away, where my brother would go back and forth for treatment. My mom was a proud, strong woman who wanted to make it on her own without any help. But how would she have felt if she was denied help that she had already paid for? It was my mom, the wife of a World War II veteran, who taught me something I still believe today. This country is the greatest in the world, and it's greatest largely because of how we value the weakest among us. Quality health care should be accessible and affordable for all Floridians. It shouldn't depend on your zip code or your tax bracket. No mother or father should despair over whether they have access to high-quality health care for their sick child. While the federal government is committed to paying 100% of the cost, I cannot in good conscience deny Floridians that needed access to health care. We will support a 3-year expansion of our Medicaid program under the new health care law, as long as the federal government meets their commitment to pay 100% of the cost during that time. Legislation we would support would sunset after 3 years and need to be reauthorized. It would also sunset if the federal government backed away from their 100% commitment to fund during this period.
Just to break this down a little bit for you, you're watching Governor Rick Scott here talking about the medical exchange, and in essence, in this press conference right now, he is talking about now embracing the medical exchange. If you've been following this story ever since the Affordable Care Act was passed, that is also called Obamacare by some. Ever since that was passed, medical exchanges were supposed to be implemented in every state according to Obamacare. The state of Florida, Pam Bondi, the Attorney General for Governor Rick Scott, had dug her heels in, joined other attorneys general across the country refusing to implement the medical exchange. But then the Obama administration said for those states that refused to implement this, they would stand to lose federal funds for the poorest in the state in terms of health care. So right now you're hearing Governor Rick Scott saying he is acquiescing. He will allow the medical exchange here in the state of Florida, allowing Obamacare to take effect in a medical exchange here in Florida.